fear is not ordinary, or like it's not extraordinary, it's ordinary. Other people have this fear. So like the prevalence of like tokophobia varies, but studies indicate like approximately 5 to 15% of women are having some fears. And then like other studies show that 20 to 70% of pregnant women experience dread connecting with pregnancy and delivery. So like that part of it is like people are having fears, people are having anxieties, people are having uncertainty around all of the changes that occur during pregnancy, during birth, like during labor, like and post-labor, right? Like all of those things compound together to be anxiety provoking.
Yeah. I'm Kelty McGuire, and you're listening to the Kids Are Childfree podcast. Hello and welcome to the Kids Are Childfree podcast. All right, for any of you who are on the fence, or maybe you've already made your Kids Are Childfree decision, let me know if you've ever had apprehension as a woman to think about childbirth, right? Like, you want me to push what out of where? That sounds really full on and intense. And so I think it's very normal that we have a certain apprehension about giving birth. However, some of you who are listening to this, and what I'm hearing from some of you, is that this anxiety or fear that you have around giving birth and having a child is really getting in the way of making this decision, to the point that you're considering not having a kid, in some cases, strictly because you are so afraid of either pregnancy and or childbirth. And so if this applies to you, whether you have just a little bit of anxiety or whether it is a full-blown phobia, you're going to want to hear what we have to say today, because I have brought the perfect guest on who specializes in anxiety, OCD, and who's going to be speaking with us about tokophobia, which is the clinical term or diagnoses for someone who has severe anxiety around childbirth, and OCD specifically. Again, I'm going to let her give the more formal definitions when we speak. Gabrielle Salomone is a licensed clinical social worker who is from outside of Philadelphia, Pennsylvania. Gabrielle received her Bachelor of Arts in Psychology and then a few years later her Master's in Social Work, both from Widener University. She is currently the clinical director at Therapy for Women Center, which is based in Philadelphia and which has 3 offices in the Philadelphia area, with one opening soon in New Jersey. And they also have therapists available virtually in 42 states, including DC. Besides being a part of the day-to-day running of the group practice, Gabrielle is also a therapist and continues to work with clients. She has experience working in just about every area of mental health treatment at every level of treatment and with clients across all ages. Gabrielle specializes in working with clients struggling with life transitions, eating disorders, anxiety, and OCD. Gabrielle, thank you so much for being here today. Really happy that the lovely Amanda from Therapy for Women, you're also from Therapy for Women. You've got your swag on today for people who are listening to the recording without video. Yeah, you're repping. I am. Some swag.
Yes. We every couple of years we'll like get a store together and get like some swag that people can order directly from our staff. That, you know, because we work from home, so sometimes it's nice to have like little extras. So this is from our newest collection, our new logo.
I like it. It looks great. Okay, for everyone listening only to the audio, you're going to have to hop on over to YouTube to see the swag. Well, why don't you just tell us a little bit about yourself, and then we'll get into things today.
I'm Gabrielle. I'm a licensed clinical social worker. I'm the clinical director at Therapy for Women Center. I'm from the Philadelphia area, born and raised here. Went to college here, so never really went too far as I've gone as over the bridge to Jersey for a little bit, and then came running back to the city. I am married to my husband that I've known for over 20 years now. We met in high school. We were not together the whole time.
No.
I like to preface that we were not married the whole time or together the whole time. We did a on-off thing for a number of years, also lived our own separate lives, things like that. I specialize in treating people with OCD, anxiety disorders, eating disorders, and like life transitions, I call it. I work at, my companies that I work for is Therapy for Women Center. We don't treat just women, we treat everyone. So trans, non-binary folks, men, women, all of the above. Sometimes even some like adolescents, kids come into our practice. We have couples therapists, all the above. So I worked with men. I like working with men too, with eating disorders and disordered eating. It's one of my specialties. So yeah, that's a little bit about me. I also specialize in, I said OCD. I do a specific type of intervention called exposure response prevention, so ERP. And that's how I work a lot with my clients with their anxiety disorders and OCD and even eating disorders. So I do a lot of exposure work there. So yeah, that's a little bit about me.
Super interesting. Well, this episode is by special request. I've actually had a few of you who've reached out over the years, if you will, and said, I have anywhere from a fear or worry about both pregnancy and childbirth, as well as something we'll be talking about today, which is, and we can maybe, we can start off with the definition now. Why not? I'll offer the word up for those who haven't heard it, tokophobia. How do we define what tokophobia is?
It's a severe, irrational fear of childbirth. And it can come up in a number of ways, from anxiety and panic attacks at the thought of labor to complete avoidance of pregnancy. That is like the extreme version of it, like the complete avoidance of pregnancy. So like going through extreme lengths to make sure somebody doesn't get pregnant. So either A, avoiding sex, B, hypervigilant around ovulation. Also, they might not even be ovulating, and because they're on multiple forms of birth control and using multiple forms of birth control, and they are still having this irrational fear that they are going to get pregnant, and even think that they are pregnant or could be pregnant with all of those forms going on, taking multiple pregnancy tests.
Okay, interesting.
Yes.
And so to clarify, I would say hypervigilance is probably not the right word, but in the past, I similarly have had this angst or worry about becoming pregnant. Now, that was the case when I was on the fence, but probably even more so since making my decision. What I'm hearing, or I just want to confirm, this isn't because I know I don't want to have a child. It's more because of the childbirth piece specifically, that like this would be catastrophic if I had to give birth. Is that correct?
Yes.
Okay.
And the primary tokophobia, like this occurs in women who have never experienced childbirth and develop a profound fear of the process. Okay. And then secondary tokophobia is usually developed after a previous traumatic birth experience. So they have like significant fears influenced because of a terrible, horrific previous birth.
Okay. For themselves, or could it be someone else?
For themselves. For themselves, yeah.
Okay.
I do think that, like, that's actually kind of interesting that you say that. Like, I was talking with a client yesterday and about, like, childbirth, and, like, they had just given birth, and, how, like, they didn't have a traumatic birthing experience. And she was like, I think people like expect every birthing experience to be traumatic anymore because that's all you hear about. Yeah. Mine wasn't. And I was like, yeah, like, while I've never given birth, I have a lot of like terrible stories in my brain, not just from clients, but from friends who have overshared with me through the years. While I love them dearly, there are things that I should never know about what happened to them.
Yeah.
Should never know. So I think like having all that information is different than maybe some previous generations where it wasn't talked about, right? Like I don't think
absolutely
was talked about in the same way that it is today, or in the past 10 years. And birth stories weren't shared as much as they are now, which I think it's good and bad thing. Like, yes, we should have the information, but like, I don't know if we should have all the information, like that oversharing part.
Yeah. I think it probably depends on the person as well. Like some people, they want to be really, I don't even know if hearing about all those things necessarily means you're well informed, in the sense that like, it still is going to have, like, it's still a selective sample of certain people. And I can think of one woman in one of my recent coaching groups who said, every woman in my family who's given birth, like basically we have a history of traumatic childbirth. And I'm like, yeah, of course you wouldn't want to give birth if that's what has happened or what you've heard. And Conversely, I know, yeah.
I was going to say, I would challenge that and be like, are you all delivering at the same hospital?
Yeah, absolutely.
Providers? Because maybe that's the red flag here.
Totally. I mean, and this doesn't diminish what our lived experience is, but what we may experience as being traumatic for a medical practitioner might be like, well, that's just what the birthing experience is, right? And it partly probably depends on your view or your own lived experience of that. And I mean, I also want to say I've had quite a few friends who've had quite easeful, transformative, impactful birth experiences, even those that have been really long and challenging. And so certainly what we hear, what we see, the information that we allow sort of into our sphere of influence, I think it has a big bearing on, I'm sure it does, on how we feel about this whole thing.
Yeah. And here's the thing, right? Like hearing all those stories and like doing all that conversing around this topic is like, that's their experience from that moment and time. That does not mean that the next experience is going to happen the exact same way, because we have new emotional learning, not just emotional, but physical learning experiences that occur because each situation is different. No two situations are exactly the same. And that's why we can't prepare in a sense for like everything that's going to occur. Like, right, like worrying about the future is just causing you to worry twice for like things to happen twice, because you don't know what's going to happen. Like these predictions, but it's not guaranteed that it'll occur that way.
Yeah, absolutely. Okay, so I want to just kind of like pull things back a little bit and just talk maybe more just about sort of anxiety. We don't even have to say your garden variety anxiety. This could be that somebody has like a formal diagnosis of generalized anxiety, or they deal with panic disorder. Maybe they have another phobia. OCD, I know, is something you focus in. How commonplace, I mean, and maybe we can talk about someone who's been clinically diagnosed. How commonplace is anxiety and OCD amongst, let's call it, the general population, or women, if you will?
I used to have the statistic off the top of my head, and I'm sorry.
Yeah.
I'm
You
terrible.
can ballpark it. It's all good. I'm putting you on the spot.
I want to say it's like 10%.
Okay.
Like of the population has like OCD. I probably could find you the exact statistic because I know I've posted about it on my social media before, but so it's like it's pretty low for OCD. Anxiety is definitely higher. And I think we've seen an uptick in anxiety disorders in America and probably globally due to the ever-changing scope of the world that we live in. And, you know, anxiety disorders are diagnosed more because people are seeking treatment more, right? Like, so like that age-old thing of like, well, this wasn't around when I was young. Well, it was. They just didn't get treatment for it. They didn't leave their house for months on end, right? Like now people are leaving their houses. Now people are getting treatment. Now people don't even actually technically have to leave their house to get treatment. They're just addressing the problem versus like white knuckling life.
Yeah. Okay. And so, and the difference, and because we have an international audience, and I want to just be a little bit careful with terminology because it might not be familiar to everyone. So OCD, obsessive compulsive disorder, anxiety, there's different, is OCD a kind of anxiety then? Like, is it?
Yeah. So it falls under the umbrella, like if I pull out the DSM, right? Like it's under anxiety disorders. OCD is, you can have OCD and an anxiety disorder. You can be diagnosed.
So lucky.
So lucky, right? So lucky of you to be able to be diagnosed with both. Because there are subtypes of OCD, like tokophobia is a subtype of
And
OCD.
that was my next question. Tokophobia then is a type of OCD. Is that correct? Okay.
Yes. Yeah. It's a specific phobia. And, it's a specific phobia which falls under OCD, because there might be, right, like we talked about at the beginning, like compulsions and rituals around prevention, right? Like people are doing certain things to either make sure that it's not occurring, or like they have that rumination and then they're checking to see for reassurance to see that it didn't occur. Safety behaviors are part of like the compulsion.
Okay.
Tokophobia, like especially like those that manifest with pronounced like avoidance and compulsive safety behaviors, often like it's seen like like avoidance subtype. Like, so it's like avoidance as the subtype, which is not engaging in life, really. Avoidance is in how I define it, right?
Okay.
Avoidance maintains dissatisfaction.
Okay. So I'm just curious. I mean, you talk about life transitions, and I'm sure you probably work with people who are, have made this decision or who are grappling with this. Do you think that, or have you seen that indecision around this kids or child-free choice more likely affects people or more commonly than who have anxiety, who struggle with that? Or, I mean, is that because we talked beforehand? I mean, we also said, yeah, both of us anecdotally know a lot of moms that have struggles with anxiety or depression, what have you. So do you think it's more likely that you're going to have indecision if you have anxiety or not?
I think indecision is a part of your anxiety. Like it definitely is a form
Tell us more.
Because like think about it, right? Like it's not just indecision. Like somebody that has anxiety has indecision about everything. Should I or shouldn't I move? Should I or shouldn't I take that job? Should I go out tonight or should I stay home? What do I want to eat? Decision paralysis in some senses, right? That inability to make a decision or choice. And then they seek reassurance from others. Like, do you think I should do this? Or even like as simple as, well, what outfit should I wear today? Right? Like we all have that anxious friend. Hi, I'm that anxious friend. That's like, I never know what to buy. I never know what to wear. And I will send 17 options to somebody and be like, what should I wear today? For an event.
It's a lot to choose from, 17.
It's a number. It's usually more like
I'd
3.
be stuck too. You have too big of a wardrobe.
I've gotten much better. I will say I've gotten much better. I am in the States, we have Newly. It's it's a rental subscription. They send me like, yes, it's so
What's
nice.
the company called that you're with? I've heard of
I
these.
rent from Newly, which is like a part of Anthropology, which
nice.
is like, then you get like all the good anthro clothes for not spending $300 a piece for each item that you're getting. And it's like, it cut down on my shopping. We'll say that.
Very cool. Okay, well, maybe I need to reach out to Newly to see if they want to sponsor the podcast since we don't have a sponsor yet. That little plug, they're going to see a big uptick in web traffic and subscriptions. Okay, so, and I mean, you talked about how commonplace, was it OCD specifically? You said about 10% of people with anxiety disorders. Is that correct?
I believe so. Yeah.
Yeah.
I'm not
ballpark.
Ballparking. Like I'm not, my statistics, I used to be like really like on it. When I did a lot more, when I worked in partial care, so like part of like psychoeducation for partial care is like knowing these things and talking and like running psychoeducation groups. And so I am not as good as I used to be.
That's okay.
I've been out of the game in terms of that for like 5 years
now.
So my brain is a little mushy, especially I think COVID has done something to it.
Yeah. No problem. And I mean, listen, when people listening, my hope is that, and you're probably either listening to this conversation out of curiosity because it's just one more perspective and information about this kids or child-free decision, or because you relate to this in some way, shape, or form. Whether or not you have a formal clinical diagnosis of tokophobia, and maybe we can chat about that a little bit later, what someone should do if they suspect that like this is like a really formally problematic. But I think it's more like, is this impacting you? Is this fear of childbirth impacting you? And so how is this a commonplace fear? To fear pregnancy or childbirth? Not so much. Okay.
Not so much. Like I did look up the statistics specifically. And so figures indicate that tokophobia is a significant concern for people in many parts of the world. However, it's important to note that the estimates vary due to differences in like how their definitions are gathered and measurement methods. So like in some studies like report like a prevalence of like 3.7 to 43%. That's a large gap, right? With a pooled estimate of 14%. Like another study found that 25% of participants exhibited very high fears of childbirth, with the pathology fear occurring in like 1.6% of the subgroup that's like
Okay.
they were sampling. The variants underscore like the need for standardized assessment tools and definitions in research on tokophobia. And that data I got from PubMed. But it's not like the systemic reviews estimate like a prevalence of approximately 14% with like variations. So what's that, like how many are they gathering from that? How many people are in that study? Like that's it's hard to tell.
Yeah.
Which I'm sorry, like that's not a great answer. I know.
No, it's all good. No, this is perfect. And you know what? I think, again, to kind of go back to what I said, in a way, I want to say it doesn't matter how many people struggle with this. If this episode can help someone, and again, whether or not this is like something pathological, whether this is something that, is just one thought in your mind, if fear around either pregnancy or childbirth is something that you feel like is keeping you stuck on this decision, that's predominantly what I want this conversation to be some help with. Yeah.
And I think like, here's the thing, like I want to, a large part of like the work that I do with people is like, not generalizing, but like bringing to the forefront, like that they're not alone. Right. And like that this fear is not ordinary, or like, it's not extraordinary, it's ordinary. And that other people have this fear. So like the prevalence of like tokophobia varies, but studies indicate like approximately 5 to 15% of women are having some fears. And then like other studies show that 20 to 70% of pregnant women experience dread connecting with pregnancy and delivery. So like that part of it is like people are having fears, people are having anxieties, people are having uncertainty around all of the changes that occur during pregnancy, during birth, like during labor, like, and post labor, right? Like, and it's not just, you're not just worrying about yourself, also you're worrying about your, fetus and unborn child, right? Like, and then freshly born child, right? Like, all of those things compound together to be anxiety provoking.
Yeah. I'm curious to know. So, I mean, sometimes when we think about certain phobias, let's say if someone's scared of spiders, we might say, well, that's not really founded because unless our lovely Australian listeners, I was going to say, unless you live in Australia or somewhere with really dangerous spiders, but most spiders don't pose a risk to human health or life. I grew up somewhere where we had black widow spiders, and that always like freaked me out. I actually had like a legit phobia as a child where I would check my bed of all places every night for about 2 years. And because I thought there might be a spider. So
yeah, I was like, there's like some random number, like the number of spiders we like swallow every year.
I've heard that's fake. I don't know. Okay, you know what we don't want today is we don't want to like transfer this from like fear of pregnancy, childbirth to like, now let's talk about our fear of spiders. But the point I want to make is like, we might be able to conclude that's sort of an irrational fear. It doesn't mean that it's not founded or valid for the person who has it. I think this piece around the pregnancy and childbirth, though, is different in the sense that, like, I don't know, are some of these fears not founded? Are there not women who undergo traumatic birthing experiences that can be both dangerous to themselves and to their unborn or born child? Like, so how does a person contend with the real risks associated with pregnancy and childbirth if they're grappling with this anxiety? Like, what sort of approach would you take with this?
Probably like there's like a mix of like CBT, cognitive behavioral therapy, or ERP, exposure response prevention. And like CBT helps individuals identify and challenge negative thoughts related to childbirth, replacing them with more balanced perspectives. This approach like definitely has been shown to reduce anxiety associated with tokophobia. ERP involves like gradual controlled exposures to fear-inducing stimuli. So decision about childbirth, like doing worry stories, like about all the things that could potentially occur to help then reduce the anxiety around all the worries and fears that they're having, to watching birth videos, hearing birth stories, like different exposures like that. Another, if they're at the point where they are
Mhm.
pregnant and they're having these fears, then it's like working with their team to come up with a midwife or a doula, to come up with a really supportive plan, creating like a really firm birthing plan for that patient. Also providing like extra education, providing like comprehensive information about pregnancy and childbirth to demystify the process, because like a lot of times that's a part of it. It's like people are like,
Mhm.
I don't even know what's going to happen. Like, how does this
Yeah.
work? Addressing misconceptions that may fuel the fears. Any of the above there.
Yeah.
And then and then we can also work with psychiatrists, and
Mm.
meds are helpful.
I was going to ask if medication's ever something used as an intervention.
Mhm. Yeah, yeah. Yeah, antidepressants, like an SSRI to help manage severe anxiety symptoms, like
Mhm.
can definitely be helpful.
Okay.
Especially with like intrusive rumination thoughts, like you being
Yeah.
more anxious is putting more stress on, if you are pregnant, like your fetus and
Mhm.
all of that. So like you're just adding stress to yourself that's
Yeah.
not necessary, that you don't have to do. Yeah, but so any of those things would be the interventions, depending on where you're at. But early intervention is key, and like not just ruminating and building it up in your own mind. Uh, and then it's like also addressing with somebody like, where is this coming from? Like, why is this why is this laying on you so heavily? Like,
Mhm.
how are you talking to yourself about this fear?
Yeah.
I think it's really important. So,
Okay. I'm interested if somebody's on the fence about kids and this feels like the one big thing that's preventing them from stepping towards motherhood, what advice would you give them about that? Like how to sort of where to start? What's a first step? Should they tackle this fear, or is it like is that even are people successful overcoming birth fears, pregnancy fears?
I think people are successful over it, right? Like
Mhm.
if it's like if your birth fears then impacting your decision to have a child, like I'm so scared of birth, I'm not going to have a child. Then the
Yeah.
question is like, well, would you be disappointed that you don't have a child in the future because you allowed this
Yeah.
avoidance to remain, right?
Mhm.
Avoidance maintains dissatisfaction. So like, would you be dissatisfied with your life if you didn't have
Yeah.
a child? And then like exploring that with them. And some people are like, no, I'm completely satisfied with my life. If I didn't have a child, like I'd be fine. Like my life is fulfilled. Like I don't need a child to fulfill my life.
Yeah.
Where versus like other people are like, no, like I want to be a parent. I want to
Mhm.
parent. I want to be like, I find that I think that I will be fulfilled by being a parent and taking care
Mhm.
of somebody and loving somebody and teaching and all those things.
Yeah.
So then if that's the answer, then we need to address the phobia.
Yeah. Yeah, I guess it's sort of like, is it worth it to you to address this? Like, is what lies on the other side of this fear that you have something that you want? And I would guess that if you don't really want parenthood that much, or you feel torn, you may not have the sort of incentive, if you will, to work through this, because just like someone's scared of childbirth, it also is scary working through one's anxieties, right? Like, do you see people having resistance to doing this work to figure things out? Going to therapy, getting support, or is that usually where some of the relief immediately starts to come in, knowing they're getting that help?
I think the relief starts coming in there, like, because they feel like they have a direction to go, right? Like, they're not
Yeah.
just floating and like sitting and thinking about these things by themselves. They're actually addressing them with somebody and like combing through not just that fear of having like childbirth. It's also then that working on that decision of like, if they are a fence sitter, we'll
Yeah.
say, they, or should I or shouldn't I? Right? Like, should I do this or shouldn't I do this? And like, if my feet, like, I don't want to do this because I'm afraid of the birthing aspect of it or the pregnancy aspect of it. What if I don't like it? Okay. You might not like it. That is true.
Yeah.
That is like a short-term discomfort for the long-term payout of the child that you want, or like that you want, that you're saying you want. So like, I think like we have to sometimes like think about like, what is that short-term versus long-term discomfort of how, like, the long-term emotional payoff of doing something that's uncomfortable in the short term. So yeah, that's, I think the other thing like to think about, right, is like when we started the conversation, I talked about how there's, people go through extremes to make sure they don't get pregnant, and how is that impacting their lives? And are they doing too many rituals and compulsions that then needs to be addressed in another way?
All right, I wanted to extend an invitation for a couple of different events that are happening next week. And that is, we have our April Kids or Child-Free and Confidently Child-Free support series sessions happening. Ooh, that was a mouthful, but I managed to get it all out. Okay, so if you're not familiar with our support series, this is a series of sessions. They are 2-hour-long workshops where we have discussion, we do some reflection. I have different exercises that I take you through. I do a little bit of teaching on different topics related either to your kids or child-free decision, in the case of our Kids or Child-Free support series, or related to being child-free, in the case of our Confidently Child-Free support series. And so next week we have our April sessions coming up. On the 22nd of April, I am hosting the April Confidently Child-Free support session, which is called Old Friends and New. Or maybe it's called New Friends and Old. I can't quite remember. In any case, you'll find it on the website. But we're going to be talking about what happens when you choose the child-free path, and the fact that it can sometimes be hard when a lot of the women around you are also, well, I should say aren't also. They happen to be moms and you aren't. How do we navigate friendships with our mom friends when we're in different phases and seasons of life making different decisions? We're also going to talk about how you can cultivate child-free friendships, because that can be tricky, but I think it's really important that we also have people in our circle and network who have made the same choice as us, just as much as it can be valuable to be friends with people who've made different life choices than us. So again, that's a 2-hour session happening April 22nd. I will include the link to that session in the show notes of today's episode. Now, on the 24th of April is our Kids or Child-Free support series session for April. And this session is about navigating the fear of regret. If you are worried you're going to regret your choice, and I don't want to put this on you if you don't have this fear, but I hear from the vast majority of women and men and folks that I work with that they are afraid they're going to make the wrong decision, that they're going to regret it at some point in the future. If that's a fear of yours, this session is for you. We're going to be talking about how you contend with this fear, different perspectives on regret. We're going to be having a really wonderful conversation in terms of what specifically are you afraid you're going to regret about this decision? What's the likelihood of this happening? Are you maybe going to regret your choice? We're going to be talking about all that and more. So again, that's happening April 24th. And I will likewise link to the Kids or Child-Free support series session for April in the show notes of today's episode. All right, hopefully you got all that. Again, lots of information. I probably should have maybe done these as 2 separate advertisements, if you will, but you're smart people. You can handle it. Again, we've got 2 support series sessions happening next week, depending where you're at with your decision, whether you're still on the fence or you are pretty sure or have already closed in on that child-free choice. I will include the details in the show notes of today's episode, and you can also find the info under the Work With Me tab at kidsorchildfree.com. And I would say that's probably the case no matter what you decide, right? Because, and this is something I see a lot of the anxieties and fears that people have, whether you have kids or you don't, it's probably going to sort of manifest or present itself regardless, right? If you decide to stay child-free, unless you, which I know some women, they, have their tubes tied at hysterectomy. I am sorry, the proper medical terminology for tubes tied. This feels like a very throw off way of saying it. But, even then, I'm guessing if you have an extreme compulsion, obsessive thought around this, you might think, okay, well, what if it wasn't successful? Or what if I still get pregnant? But to think about living in a way that you're constantly, perpetually kind of obsessing about this, or something else, I'm wondering, do you think sometimes too, if somebody says, okay, I won't have a child because of this, that maybe some of those anxieties would just show up in like some other way, shape, or form in their life, even if it doesn't have to do with childbirth? Or is it usually really just pointed to this one thing?
Sometimes OCD is whack-a-mole.
I'm just laughing because that came up in one of my sessions a couple of days ago with my clients. And I was like, feels like, because we were talking about difficult emotions. It's like, just when I think I've like subsided that grief, it's like, then resentment pops up. And then over here, frustration pops up. So I said, it's like whack-a-mole.
OCD can be like whack-a-mole, and it jumps to other things in our lives. And OCD likes to attach itself to things that are important to us, that are meaningful to us, that mean a lot, and like we have a strong connection to. It takes hostage of the things that bring us, joy and feelings of like good feelings, right? Like about like when I work with clients, like OCD comes up a lot around things that are really important to the person. Family, spouses, kids, pets, jobs that they're really passionate about, like things like that. Like OCD comes in and takes over and takes hold, and like that fear of like, well, if you don't do this, then something bad's going to happen to them.
Yeah. I relate to that, actually. I used to have, it was nothing formally diagnosed, but like a real kind of obsessive thought and worry about losing my husband, Chris. And I know a lot of people, nobody wants to lose their partner. And I think it's a very like probably healthy, normal fear. But like this was like, it really plagued me for quite a long period of time. And I can identify probably where that first came from. But yeah, absolutely. I had to remind myself, like, you never think about the family member you don't get along with dying, right? Like nobody does. You're like, they're going to live forever. And I do think it often, like these sort of obsessive thoughts and whatnot, point themselves to and attach themselves to those things that we really love and that we're afraid of losing, or like, okay, so I go ahead. Sorry.
Or haven't taken from us. Right. And so like, I think about like OCD and like that fear of pregnancy, and it's that fear that like this is going to be taken from us, like that opportunity is going to be taken from us, like that experience we won't get to have because of this fear.
Yeah. So I'm sure the question on some people's minds, especially those people who maybe this isn't the only thing standing between them and a clear kids or child-free decision, but they have some other concerns and, they don't know if they're cut out for or want to be a parent, and they're worried about leaving their child-free life behind, et cetera. My line of thinking would be, okay, I'm trying to figure out what I want. What I'm hearing from Gabrielle is maybe I do want to have a child. That's why I have this fear. Do you think that could potentially be an indicator for someone that if they're really afraid of childbirth, maybe it means they want it? Or is that an unfair conclusion to come to?
I think it could be an unfair conclusion, right?
Yeah. Like I want to be careful with that one.
Yeah, it's like an unfair conclusion, right? But like, I think you should explore all of it, right? Like, is it the fear of the unknown? Is it the fear of the pain? Like, do you not tolerate this or that? Or like, do you have preconceived notions of like what is going to happen or not? I think a lot of it is around like, for tokophobia, like, and the treatment is reducing avoidance, improving tolerance for uncertainty, and like self-efficacy in terms of like repeatedly confronting and managing the anxiety. Patients develop a strong belief in their ability to handle childbirth. Like that mirrors like the way ERP helps OCD, patients regaining control over their obsessive thoughts and actions. So like, I think a lot of it is like working on like the avoidance and the uncertainty, and like build resilience against the distress caused by that uncertainty. Because when uncertainty about childbirth processes fuels the fear, the ERP like can gradually help someone feel more confident and less overwhelmed about it.
Okay. And just to clarify again, so the exposure, ERP exposure, what's the R?
Response.
Okay. P?
Prevention.
You've just said it like 4 times, but
it's okay.
Oh, my like 2-second goldfish memory. Okay, exposure response prevention. And you kind of alluded to this, but I just want to clarify because, of course, people might think like, okay, exposure is me getting pregnant and having a baby. When we think about how that looks in the form of like exposing ourselves to childbirth, like what would an example be? You mentioned like maybe, and you probably wouldn't do this on your own right away, but like seeing a video of childbirth or hearing stories of childbirth. Those are the sort of things you mention as exposures.
Yes. Yeah. Doing a worry story about your, like what would happen if you got pregnant.
Tell me about worry stories. I want to hear what this is. I think I like worry stories.
Yeah. Worry stories are pretty cool. They can be really helpful. The goal of a worry story is to work, like it's a helpful tool to manage your excessive worries. It involves writing a worry script. It like helps you take up the energy and time like that causes you like a great deal of anxiety. Like so working through writing it all down. Like that's really all it is like writing the worst thing down that you could think of and being really detailed and really descriptive in what your worst case scenario is, right?
Yeah.
So your worry script should be about the worst case scenario for one of your worries. Your script should be vivid and visual, so including your 5 senses, as well as feelings and reactions. And then like you should write your worry script daily and then set it aside and then read your worry script. And whether you're reading it, I've had clients had to like visually read it out loud. Like these are all different levels of anxiety provoking situations for them. And you do this for about 2 weeks.
Okay.
And the point of like a worry script is to help decrease your anxiety. Like the goal of a worry script is to not make you like no longer care. Like the goal of the worry script is not to make you no longer care. It's to show you that you can tolerate that discomfort. And like sometimes the people think like just writing something bad will make it happen. Like that's not true.
Yeah, I've had that suspicion too with talking about things. I often share the story of how I was so fearful about losing Chris, and I use it as an example with my clients. And of course, my husband teases me. He's like, every time I come in the room, you're talking about me dying. But I've had that thought. I had it just yesterday, actually. I guess we can characterize it as an obsessive thought of like, what if I make this happen because I keep talking about it and I'm putting energy behind it? So, I mean, I just relate that. It sounds similar. Like people worry, okay, writing down this bad birth story, for example, or what I think is going to happen will make it happen. But what I'm hearing is there's no indication to suggest that.
Yeah. So research shows us that people with like generalized anxiety disorders have a hard time dealing with their negative emotions, such as like sadness or fear. And they either try to push the negative feelings away or they keep switching worry topics. Unfortunately, like neither of those techniques work.
Yeah.
It does
can confirm as someone with a generalized anxiety disorder. Thank you very much.
Yeah. And so like why worry scripts are different is rather than putting all your energy to avoiding the upsetting thoughts and images, you can instead face them head on by writing your biggest worries, and you'll be facing those negative thoughts and bad feelings. You also get a clear picture of what it is you are really afraid of, which will give you like a chance to like really think about and process your anxiety and change how you think about your fears. Like a lot of times it goes like 0 to 100 of like what the bad thing is that's going to happen, like out of nowhere. And you're like, wait, how did we even get here? And you're like, you're like, I don't even know, but that escalated quickly.
Totally. Okay. I actually, it's funny because I've used a similar exercise with my clients now, not to the degree of the repetition you suggest, but when we talk about fears in one of my programs, we like really, to use your words, look at that worst case scenario. And what I see is like, we ruminate on our fears, but at the same time, we don't really get in depth with them because we feel uncomfortable, to your point. So having people go big or go home, as I call it, to look their fears in the face, to really get hyper detailed, to like magnify it or almost be a bit theatrical, like over the top, and then I die or whatever we think's going to happen. I'm bleeding out on the table or this horrible thing, or I'd never sleep again for the next 5 years. Yeah.
I'm going to be like, it escalates quickly a lot of times to like, and then this will happen and then I'll be homeless. And it's like, how did we get there? We were just talking about you losing your friends. How do we become homeless? So, I think like a lot of times like worries fall under like one or two themes and like they're very similar to each other.
Okay.
So,
all right.
Yeah.
What are the themes you typically see, would you say?
Death and like death, like them dying, there's important people dying.
Yeah.
Or that they like end up alone.
Mm-hmm.
Right? Like that's a lot of times the themes that I say is that like fear of being alone, right? Like even death like is fear of being alone.
Yeah, absolutely. 100%. Okay. Curious, do you know or have you heard of clients or people struggling with this phobia who've either decided to stay child-free because of this fear? And if so, do you know how that kind of worked out for them? I know maybe we don't have the long view yet, but is that a reason that some people choose not to have kids? And how does that work out?
I like personally don't know of that. I could see that potentially being like why somebody avoids. When I've worked with people with some of these fears, it's like, well, what is your long-term goal? Like, what would you like your future life to look like? And working on and through some of that to determine like where they want to be and what they want to do. So anything's possible, right?
Absolutely. And on that front, like, do some people then say, okay, I'm going to opt for a C-section because of fear? Or I don't know if like this is like a founded reason for surrogacy, but like, do some people opt for different or adoption, different ways of having a child because this fear is so intense? Or is it typically more that they just try and work through it and have a vaginal childbirth, if you will?
I think like that's where it like comes up as like the preparation for it, right? And like trying to come up with personalized birthing plans, like because surrogacy is not available for everyone, right? Like
Absolutely
is expensive, and also finding a obstetrician that will like give you that free choice of going in for surgery for via C-section, right? Like because that is a major surgery. They're cutting
absolutely
lots of layers there. Even down to like, will your insurance necessarily pay for that here in the States if it's not medically necessary? So all things we have to like think about. And I think it's a case-by-case basis.
Yeah, absolutely. And I think with that, there's also like lots of other layers, right? It's not just looking for like a potential solution for this birthing fear, but also saying like, do I want to have a child via adoption? What do I think about the ethics of that or surrogacy? Like there's lots of different layers to peel back and look at. It's not just like, what's the easiest way for me to bring a child into this world? Of course, we have to look at like the bigger picture, to your point, and what it is we actually want.
Yes. I think that's like a big part of it.
So if somebody's listening to this and they're identifying with this, or they think, oh gosh, maybe I even have tokophobia, and how do I know if it's tokophobia or just regular, birthing fears? And part of me is like, does it matter if it's impeding on you making this decision or your comfort with this idea of having a child? And I'll let you answer that. But what would you say they should do? Who should they look for? Should they seek help in the form of a practitioner like yourself? Or what would you say?
I would say like potentially, right? Like tokophobia is like intense fear and anxiety, panic attacks, avoidance behaviors, intrusive thoughts or nightmares, feeling helpless, loss of control, sense of impending doom, negative expectations like shame, guilt. It's big. It's difficulty concentrating or functioning, like relationship problems, avoidance of like even discussing pregnancy or childbirth.
Okay.
Avoiding doctor's appointments or failing to complete like necessary like maintenance of even like if when somebody's pregnant, like if they're like avoiding even like that idea of like that they're even pregnant, like
Okay.
even down to like requesting a cesarean when it's otherwise like not medically necessary. Like those are all symptoms. And physically, like it manifests as, physical anxiety symptoms, sleep disturbances, depression sometimes, and like even sometimes like postnatal depression. Tokophobia can increase like the risk of developing postnatal depression after birth. So there's lots of it. Like I believe there is a screening that is used, like a fear of birth or screening, and I think the other one's like childbirth attitudes questionnaire, that can help doctors determine if that's somebody's going on, or if like you seek a therapist, like they could also provide that rating scale and that screening to determine like if it is, and then like develop a treatment plan for someone.
Okay. But what I'm hearing is, and this idea of like if it qualifies or not, if you feel like this is getting in the way of things, like I'm hearing it's a good idea to talk to a reputable practitioner, whether that's starting with your family doctor or gynecologist and or therapy. And I'm guessing someone who specializes, would you say in OCD is a good idea, or which should someone be looking for?
Yeah, I would say it's like somebody that's anxiety, or even somebody that's like specializes in prenatal, postnatal, like prenatal, postnatal therapist, therapeutic care. They should be able to help you address some of that.
Okay. Well, before we wrap things up, and I have to say, I mean, I predominantly had you on here by recommendation to be able to speak about anxiety, tokophobia, OCD as it pertains to childbirth as well as pregnancy. But as customary with so many, pretty much all of our guests, I also love to usually ask a little bit about one's own kids or child-free decision and where they're at with that journey. So where do you characterize yourself in this whole decision boat, if you will?
We are on the nightmare boat of infertility treatment.
Oh gosh. Okay. So now, had you always known you wanted to have a child or children?
No.
You're familiar with this fence sitting thing.
Yeah. My husband and I were the epitome of fence sitters of like, we literally were like, if it happens, it happens. And then like, I got some test results back and they're like, well, it's not going to happen unless you take some active steps to get pregnant. And,
okay.
And then we were like, well, do we want to try and like this actively? And it's like,
yeah,
well, let's see what happens and like, let's try. But we are not like, well, like we're not into IVF. Like we don't think that it is for us. I've also like not responded very well personally to medications for infertility medications, like the hormones and stuff. Like it has been kind of terrible. We did about 6 months of like pretty consistent infertility treatment list, summer, fall, and like it was it was pretty nightmarish. And I just like the hormones and the emotions and then the pressure of like, is this working? Isn't this working? Are we doing enough? Aren't we doing enough? How many supplements can somebody possibly take? It's exhausting.
Apparently a lot, I'm guessing.
A lot. And then like also like they're like, I don't know, everything under the sun of like, don't do this and don't eat this and don't drink and don't eat, like
don't eat
a lot of stuff. Pretty much don't breathe, don't do anything except for like have sex and like monitor every single symptom under the sun.
Yeah.
And I'm like, this is exhausting and miserable. And like, I like to live my life. I want to go out and eat. I want to eat all the raw seafood that I could possibly shove in my face at any given time. And also I like a cocktail. Thanks.
Yeah.
So that's where we're at right now.
Okay. And I'm curious, so I've heard both perspectives, and I'm interested how it is for you, because what I hear from some people, so a lot of times when we're on the fence and we have this like, let's just see what happens approach, or I'd be happy with either. I hear one of two things. People say that they feel like in some way, I don't want to say it's buffered them from pain, but it's maybe made navigating infertility, if they face that, maybe a little bit lighter, maybe because they don't feel like they have as much skin in the game, so to speak. I've also heard the inverse, where somebody says, it really, as soon as I got into it, when we got on that track of let's try, they go to the nth degree of like, okay, I really want this now. And it becomes very painful. And it's a clarifying thing for them facing infertility. So I'm guessing what's it been for you? I don't want to say I'm guessing. I have no idea. Tell us.
I think I'm on the front end of that, of like, it's a buffer. Like, it is still like painful. It's still uncomfortable. Like,
sure,
people are completely insensitive, like, and say the most inappropriate things. My favorite line to say to somebody when they are like, well, when are you guys having kids? What are you doing? What made you say that? When are you having kids?
Yeah.
When are you getting pregnant? So like, that's my like go-to line. Or being like, I don't know. When are you doing those same things? Like, does it really matter? I think like there is a buffer, right? Like, my husband and I are both like very much in the camp of like, we don't need children to fulfill us and fulfill our lives. Like, we have very fulfilling lives and jobs or careers. And I don't even want to call it jobs, like career/callings.
Yeah. I get that.
And, we have plenty of, we have my sister and her son. She's about to give birth. Actually, like, we're on baby call duty right now as we speak for the next
exciting
2 weeks. Because when she goes in labor, we'll take our godson nephew. So we have like lots of nieces and nephews. We have our friends' kids like triple us, if we're being honest. Like, we have a fall party, and this past fall we had like 50 people and about 70 children running around in our
yard.
But thank God, cool. Our house backs up to a park that, like, it's probably exaggeration, but there's probably like 20 kids running around this party.
Yeah.
Because all of our friends seem to have like 2, 3, 4, 5 children.
That's a lot of kids. That's a lot of children per family. Okay.
Yeah. So we get our load and share of children. Like, even we just went on vacation with my best friend and her husband and their daughter. We took she's like my pseudo niece. We just went to Disney as a family together. She's an only child, so it's 4 adults and 1 child, and she loves every minute of it. And we love her, and so we're blessed and lucky in that sense. And who knows, right? Like, what the future holds of, like, if we get pregnant, we do. If we don't, we don't. There's also potential, like, I don't know, maybe we foster. There's plenty of kids out there that need families.
Sounds like there's an openness there, right? And of course, which pertains well to our overall topic of anxiety today, we can't control the future and we don't know what it holds, but it sounds like there's an openness there. And also, I'm sure it sounds like it's been a challenging time. So I thank you for sharing this with us and where you're at on your decision. And I wish you luck with everything.
Yeah, thank you. Yeah, it's like, it's very interesting to be a fence sitter that was like, I like to say I was like a fence sitter that got kicked off the fence.
Okay. And kicked off the fence by finding out that it wasn't as likely to have kids or possible. Okay.
Yeah, you're like a fence sitter that's not like that. You're like, well, if it happens, it happens. Or like, don't I? Like, I welcome it, but like, I don't need it to fulfill myself. To then be like actively kicked off and be like, you need to try to do something. You can't just sit there.
Yeah. Okay.
So that's my take on it.
Sometimes life kicks us off. And I think a lot of people listening, it's like, we want this epiphany moment, this life experience, this event, whatever it is to happen. And for some of us, it does happen. And P.S., it may not be the kind of like happy event that you hope for, right? Like, yes. We hope we'll have like a message from God or something saying like, this is your path in life. This is what you need to do.
I don't think that's usually how it works.
No, not from what I've heard so far. Well, thank you so much for coming on, Gabrielle. How can people find you? Are you on Instagram?
I am on Instagram. Yeah. You can find me at Live Well with Gabrielle. Our, company I work for is Therapy for Women Center. We have therapists in 47 states. We have...
Oh my gosh. I didn't know it was so many.
Yes.
Wow.
Yes.
Okay.
Therapists located in 47 states for virtual therapy. We have 3 offices in the Philadelphia area, Pennsylvania proper. And exciting news, opening in May, our 4th office in New Jersey. So we're very excited about that. And yeah, we have lots of different therapists addressing lots of different things for people. So
perfect. Okay. Well, we will make sure to link to all those places. And if you've ever listened to me talk at length about anything, I'm a huge proponent of therapy. I've had many different practitioners and counselors and psychiatrists. And yes, it is such an important part of just existing in this crazy world, but it also can be such a big help with this decision, whether it's in tandem with a coach like myself or looking exclusively at getting support with this via a therapist, or some of the other things that come up, right? Sometimes we recognize there is something else going on. It's not just that, yes, we're undecided about having kids, but there might be something that's holding us back. And as Gabrielle and I talked about, I think we owe it to ourselves to explore those things and see what resolution we can have, no matter what we ultimately decide, because otherwise, it's going to keep kind of whack-a-moling popping up.
Yeah.
Whatever moles do.
Yeah. Like it can come from a number of different things. And there might be some underlying things around trauma or childhood things or your own relationship with your parents affecting your concerns about being a parent. We didn't even get into that. That's
another great topic.
That could be a whole nother topic that we dive into at another time.
Yeah. That's a relevant one for a lot of people, I think.
Yeah. So a lot of good things there.
All right. Well, yeah. Therapy for Women Center. Can only say good things about the practitioners that I've connected with there. So thank you so much for coming on.
And thank you for having me.
Yeah, anything else people need to know before we go?
I think just take this the phrase avoidance maintains dissatisfaction and see how you can apply that to your life.
All right. I love it. Well, thank you, Gabrielle. And I hope you have a beautiful rest of your day.
Thank you. You too.
If you have found this conversation or any of the other episodes of the Kids or Childfree podcast helpful, insightful, if this podcast has created some small or large shift for you that has helped you with your kids or child-free decision, I want to ask you to please leave a rating or a review in either Spotify on the Spotify app or Apple Podcast app. This is such a small, simple, quick thing for you to do that can create really big impact in terms of helping this podcast to get discovered by more listeners and help more people who are on the fence with this decision. So again, before you go about your day or listen to another episode, hit pause, leave a rating or a review, again, in-app, whether you're on Spotify or Apple Podcasts, and know that both I will be very grateful as well as all of those people who will be discovering this podcast thanks to your rating or review.